Medicine in the Middle Ages didn't heal you. It studied your pain, renamed it, and then made it worse. There were no hospitals as we know them, only overcrowded monasteries, bleeding rooms, and back-alley apothecaries reeking of mold and desperation. If you were sick, your best hope was that your illness was visible. Because if it wasn't, they would assume it lived in your soul, or worse, in your sins. Physicians wore long robes and titles in Latin, but their tools hadn't changed since Rome fell. They didn't examine symptoms, they examined your horoscope. Diagnosis was determined by the stars, the season, or how much bile you vomited before noon. And once they had an idea, they didn't ask if it made sense. They reached for the knife. The most common treatment? Bloodletting. For everything. Headache? Drain it. Fever? Drain it. Childbirth complications? Drain it. Plague? Definitely drain it. Leeches were attached to your eyelids. Veins were sliced open with unwashed blades. Entire bowls of blood were extracted, not gradually, but in one go. Patients fainted. Many died. And those who didn't, they were bled again, just to be sure. If bloodletting didn't work, they'd induce vomiting, or diarrhea, or both. The logic was that disease came from imbalance, and the way to fix imbalance was to purge the body like a dirty chamber pot. Enemas made with wine, vinegar, or animal bile were common. In some cases, feces from healthy individuals were applied to open wounds. Not as a last resort, as standard procedure. Surgery, when attempted, was done without anesthesia. Pain was part of the process, and in some cases, part of the penance. You were restrained, screamed into cloth, and hoped you passed out before they finished sawing. Infection was a given. Survival was a miracle. And if you died, it was usually blamed on your weak constitution, never the man with the bone saw and the tremor in his hands. Herbalists and women healers had better track records, but they lacked licenses, which made them criminals. Their cures were called witchcraft. Their success was suspicious. The church persecuted them. And the male physicians, threatened by their results, called for their exile, their silence, or their execution. In the medieval world, medicine wasn't about healing. It was about order. Your body had to obey doctrine, even if it killed you. For over 1,000 years, Western medicine was governed by a single theory, one so wrong, so stubborn, and so deadly that it turned entire civilizations into test subjects. It was called humoral theory, and it was everywhere. The idea was simple. Your body contained 4 fluids: blood, phlegm, yellow bile, and black bile. Health meant balance. Illness meant imbalance. That was it. No bacteria, no viruses, no trauma, no anatomy. Just a mystical cocktail of imaginary liquids swirling around inside you, trying desperately not to offend God. If you had a fever, you had too much blood. If you were melancholic, it was black bile. If you coughed, it was phlegm. If you were angry, it was bile again. But the yellow one this time. Treatment was never about understanding what was wrong. It was about realigning you with an abstract theory written centuries earlier by people who had never opened a human body. The humors became a script, and doctors, its enforcers. Everything was categorized through this lens: temperament, morality, beauty, even personality. Women were thought to have colder, wetter humors, making them naturally more emotional and unstable. People with dark skin were said to have more black bile, leading to a whole pseudoscience of racialized illness. Poor people were assumed to be full of phlegm, laziness, and imbalance, and were treated accordingly. Medical books weren't manuals. They were moral compasses. They told you not just how to cure someone, but whether they were worth curing. If a patient didn't respond to bleeding or vomiting, the fault was often seen as spiritual. Maybe they had sinned. Maybe they weren't praying enough. Maybe they were meant to die. Doctors prescribed food based on humors: lettuce to cool the blood, wine to dry out the phlegm, leeks to stimulate bile. Entire diets were built around these assumptions. In some cases, healthy people were subjected to preventative bleedings just to keep their fluids in check. The problem wasn't just that the theory was wrong, it was that it refused to die. Even as corpses piled up, even as new observations contradicted everything, the medical establishment clung to the four humors like a priest to scripture. Because abandoning it meant admitting that generations of treatment had not just failed, but killed. And that was unacceptable. So they kept draining, kept vomiting, kept purging, and people kept dying in perfect theoretical balance. Surgery in the Middle Ages was not a medical procedure. It was a performance of desperation, loud, messy, and almost always fatal. Doctors, in the academic sense, didn't perform surgery. That was left to barber surgeons, men who shaved beards, pulled teeth, lanced boils, and amputated limbs with the same blade. They had no formal education, no training in anatomy, and no sterilization. They learned by doing, and by failing. There were no gloves, no antiseptic, no anesthesia. Pain was part of the ritual, a proof of strength, of faith, of submission to divine will. Screams were common. Survival was rare. Infection was inevitable. Tools were crude. Saws, hooks, hammers. Wounds were cauterized with hot irons or boiling oil, not to close them, but to stop the bleeding and burn out the bad. Stitches, when used, were made from unclean thread and pushed through torn flesh with thick, blunted needles. A common surgery? Trepanation, drilling a hole in the skull to release evil spirits, correct imbalances, or simply to experiment. No sedation. No understanding of what lay beneath the bone, just pressure, pain, and prayer. And beneath all of this was a deep, enforced ignorance of the human body. Dissection was forbidden in much of Europe for centuries. The Church saw it as desecration. The body was sacred, even in death. And so, doctors guessed. They operated blind, relying on ancient texts and copied diagrams drawn from animals, not people. When dissections did occur, they were more theatrical than scientific. A professor would read from Galen, a Roman physician dead for over 1,000 years, while an assistant sliced open a cadaver. The goal wasn't discovery, it was confirmation. If the body contradicted the book was considered correct. This refusal to look, to touch, to learn from the flesh in front of them, created a system where medical knowledge stagnated, where death was common, but understanding it was forbidden, where the living paid the price for the dead to remain comfortable. And so surgery became a paradox, a practice without knowledge, a tradition of pain without precision, a spectacle of suffering that called itself progress. And through it all, the body, bruised, bleeding, trembling, remained the silent witness to a medicine more interested in order than in healing. In many medieval communities, The person most likely to save your life wasn't a physician. It was a woman. She didn't wear robes. She didn't speak Latin. She didn't quote Aristotle or Galen, but she knew how to ease a fever, close a wound, and bring a child into the world without killing the mother. Her knowledge came from generations of practice, oral tradition passed from midwife to apprentice, from herbalist to daughter. She understood herbs not as symbols, but as tools. She knew what worked because she had seen it work. She didn't need a theory, she had outcomes, and that made her dangerous. The official medical establishment, male, clerical, university-trained, viewed her not as competition, but as a threat to order. She healed without permission. She operated outside doctrine, and worst of all, she succeeded. So the narrative was rewritten. She wasn't wise. She was suspicious. Her remedies were unnatural. Her presence at a birth that went wrong, evidence of sorcery. If she cured someone the doctors had failed to save, they called it a deal with the devil. And so she was hunted. The line between healer and witch blurred intentionally. Midwives were accused of tampering with life and death. Herbalists were charged with blasphemy for using roots that priests couldn't pronounce. Wise women were dragged into trials where evidence meant nothing, only fear, rumor, and power. At the same time, the rise of official medicine pushed women out entirely. Universities banned them. Guilds excluded them. Licenses were reserved for men, and knowledge that had once grown in gardens and kitchens was burned with its keepers. Even when male doctors began copying herbal remedies or childbirth techniques, they claimed them as new discoveries, ignoring the women who had used them for centuries. The profession that condemned them stole from them, silenced them, then declared itself the only authority. And so medicine evolved, but only by erasing the hands that held it first. It wasn't that women didn't understand healing, it's that they understood too much. And in a system built on hierarchy, that was unforgivable. When the Black Death swept through Europe in the 14th century, it didn't just kill bodies, it exposed how little anyone understood about them. Doctors were helpless. Priests were overwhelmed. And the people? They watched entire families die within days, sometimes hours, with no explanation, no cure, and no mercy. The symptoms were terrifying: fever, vomiting, blackened skin, swollen lymph nodes the size of fists. And when no one could explain it, they blamed everything. The stars, the Jews, the poor, the air itself. The medical response was a cocktail of desperation and ritual. Physicians wore beaked masks stuffed with herbs and spices, believing pleasant smells could ward off bad air. These plague masks, iconic now, offered no protection, but they gave the illusion of control. Patients were sometimes forced to sit in rooms filled with smoke or incense, meant to purify the miasma. Others were bled again and again, weakening their bodies as infection raged. Some were coated in mercury. Others had live chickens strapped to their boils. And if that didn't work, they prayed, not for healing, but for explanation. Entire towns whipped themselves in the streets, believing the plague was a punishment for sin. Bodies were thrown into mass graves without ceremony. Doctors wrote guides with chapters like How to Treat the Air with Fire or Why Saturn is Angry. There were quarantines, but applied inconsistently. In many cities, the rich fled early and took the disease with them. The poor were left behind to rot. In some places, Doctors refused to enter homes at all. Monasteries barred the sick from entry. The very institutions meant to protect life had no tools to stop death. And as the death toll rose, so did the paranoia. Foreigners were blamed. Beggars were attacked. Women healers were accused of witchcraft. Entire Jewish communities were massacred under suspicion of poisoning wells. The plague didn't just collapse bodies, it collapsed trust, order, reason. Medicine didn't rise to meet the crisis. It retreated into superstition, fear, and spectacle. And in doing so, it revealed itself for what it was. Not a science. Not yet. But a shadow. Fumbling in the dark while the world burned. In the medieval world, medicine didn't fail quietly. It failed loudly, with confidence, ritual, and robes. It failed with knives in hand, scriptures on the table, and blood in the bowl. It wasn't the lack of knowledge that made it dangerous, it was the refusal to question what little knowledge it had. For centuries, the sick were cut, drained, purged, cauterized, and blamed. The treatments didn't heal. They punished. They punished the poor for being ill. They punished women for knowing too much. They punished bodies for being different. And they punished doubt most of all. Because the greatest sin in medieval medicine wasn't ignorance. It was disobedience. To question the humors was to question Hippocrates. To challenge bloodletting was to defy Galen. To listen to a woman healer was to defy the university, the guild, the priest, and the page. And in a system built on hierarchy, authority mattered more than results. So the sick were treated according to theory, not condition. The dying were offered ritual instead of relief. And those who survived did so in spite of medicine, not because of it. Even when evidence contradicted doctrine, it was the body, not the book, that was wrong. Even when a cure worked, it was called heresy if it came from the wrong hands. And yet, through it all, medicine insisted it was sacred, that it was chosen, that its cruelty was necessity and its pain, purification. But history remembers differently. It remembers the leeches, the sawdust floors, the screams behind monastery walls, the flames where healers once stood, the lives shortened by the very hands meant to protect them. In the end, medieval medicine didn't cure disease. It institutionalized suffering. It built a temple of pain and called it science.